Hello, this is Dr. Neil Baum from New Orleans, and I would like to use this video to share with you some suggestions for enhancing referrals from other physicians, as well as suggestions for non-medical referral sources. The lifeblood of any practice is the opportunity to attract new patients to our practice, and leading the list is physician referrals. There are four pillars of a successful practice. Those are the patients already in your practice, the ability to attract new patients to your practice, having a highly motivated staff, and your relationship with your referring physicians. So let's begin with talking about developing physician referrals. The objective is to see that your name crosses the mind and desk of the referring physician and their staff as frequently as possible. Looking at why physicians refer, almost at the top of the list is your ability to report back promptly. I call to your attention that gifts at Christmas and holiday time are very unlikely to generate referrals from other physicians. The traditional referral letter is far too long, arrives 10 to 14 days after a patient is seen, if it is mailed to that patient, and it's expensive. The typical electronic medical record note is far too long and doesn't really lead itself to being read by a referring doctor. There are only three ingredients of an effective letter. It's the diagnosis, the medications, and the treatment plan. The goal of an effective letter is to see that that letter arrives on the desk of that referring physician before the patient returns to see that physician. An example of an effective referral letter is an example that Dr. Bill Smith referred Jane Doe, and these would be examples from your notes in your electronic medical record that the patient had stress urinary incontinence, physical exam revealed a moderate cystocele, lab test negative urinalysis, you recommended medication, a urodynamic study and cystoscopy, and a mid-urethral sling with an anterior repair. This is a computerized referral letter leaving blanks to fill in diagnosis, medications, and treatment plan. And this is how that referral letter would look, filling in those blanks with those three necessary ingredients. If you have an electronic medical record, often templates can be created where the fields are filled in with the patient's name, the referring physician, and then listing automatically the medications, the treatment plan, and the diagnosis. Next, it's a nice perk to give your referring physicians your cell phone number and your back line number in case they would like to get access to you quicker than calling your office. Oftentimes, referring physicians will talk to you over lunch or at the surgical lounge and will ask a urologic question. It's important to be value-added resource. And when they ask you a question, send them educational material. This is an example where a referring physician asked me a question about hypogonadism. I answered the question and sent educational material regarding the treatment of low testosterone. It's very important that when you are with the patient that you do not be interrupted. However, there are situations where interruptions are going to be a necessity, such as calls from the emergency room, operating room, or intensive care unit. When other physicians call your office, have your staff inform that referring physicians that you are actively doing a procedure, have them ask if it's an emergency, and if you can call back between patients. I think it's also value added to share medical information with your referring colleagues. I've developed what is called a no meeting journal club, where I see interesting articles that appear in my literature and feel that they would be of interest to other physicians. And I would take that article, and I know that they will not read the entire article, so I target their reading with a post-it note placed on the first page of the article, telling them where I suggest that they look for the nuggets that are located in the article. And then I circle the 1 or 2 sentences. And this way I am assured that it is likely that they will read this 1 or 2 sentences and gain some valuable information. I think it's a good idea to provide your referring physician about updates on any changes in your specialty. And it's important to send a newsletter, perhaps quarterly or every 6 months, to your referring physicians, letting them know what is new in our specialty. I think it's a nice gesture for a urologist to contact referring physicians when we admit their patient to the hospital. After a surgical procedure, you don't need to talk to the doctor. However, to let them know that the surgery proceeded fine and leave a message with their nurse or their receptionist. And also, if there's a significant path report and when you discharge their patient from the hospital. So the bottom line on physician referrals is that you have to be a good communicator and see that that referring physician remains the captain of that patient's healthcare ship, and you provide them with all the necessary valuable information regarding their patient. I think it's a good idea to meet every physician who refers a patient to you. A good idea in July of every year, when new physicians start practice and they send out their announcement, to introduce yourself with a letter, and if possible, have a face-to-face visit with that new physician starting practice in your area, and let them know about your areas of particular interest and expertise. It's also very nice to acknowledge the accomplishments of your referring physician and their families. An example being a magazine that lists the top doctors in the community. And if one of your referring physicians is on that list, send them a note of congratulations. It will probably be one of the only notes that they receive from one of their colleagues. I also think it's important to recognize that non-medical referrals are a great option and possibility. Don't forget that you can get referrals from other urologists in the community and in the surrounding communities. If you are just recently graduated, you probably have skills that a older or middle-aged urologist doesn't have, and you can offer to be of service to other urologists in the nearby area. Non-physician referrals are also very important, and I would like to mention pharmaceutical representatives and nurses are often contacted by potential patients and ask for suggestions regarding urologic referral. So letting these people know that you are available to see their friends and family is very important. Other non-medical referral sources are shown in this slide. And don't forget that these people often have patients and are asked by their patients or their clients what would be a good referral source. And these other non-medical referrals can be very valuable to your practice. Finally, I want to mention about unique and useful gifts. As I told you in the slide earlier about what attracts referring physicians, way at the bottom of the list are gifts, especially not a wine and cheese basket delivered the day before Christmas, because that's going to get lost in the dozen that they receive from other referring doctors. I like to think of a gift that is useful to the referring doctor, or something that arrives frequently, like on a monthly basis. One of the best ones that I ever gave to referring doctors was the personalized luggage tags. And I heard so many compliments of how useful these colored personalized luggage tags were to that were given out at holiday time to referring physicians. In summary, I think it's important that you become a value added resource to your referring physicians. You want to see that your name and your practice is frequently in front of your referring doctors. I hope you found this information on physician referrals and non-medical referrals helpful and useful. If you would like a copy of my paper on physician referrals, kindly contact me at the website located on the last slide. Thank you.